We now know how to define anxiety, how to rate the severity of anxiety. We know how common anxiety is. We know the evidence that it shortens lifespan. But what exactly is going on here? First of all, how does it occur? What's the mechanism whereby people become anxious? And secondly, when people are anxious, how does that lead to a shorter lifespan? Let's take a closer look at mechanism. Anxiety is complicated. Anxiety is complicated, loneliness is complicated, depression is complicated, psychiatric problems are complicated, and there are multiple factors that contribute to development and progression of these conditions, but we have a few categories that we like to talk about. One factor in explaining how anxiety develops are genetic factors, things that we inherit from our parents. And this does account for a portion of people who are anxious and a increased likelihood in certain people to become anxious, but it's not the whole story. There are also factors in how we allocate our attention. Allocating extensive attention to threatening stimuli is one characteristic of people who are anxious. They're on the lookout for bad. Another thing is they misinterpret ambiguous stimuli as threatening. So things that are otherwise considered neutral, someone who's predisposed to be anxious will think of them as personally threatening. I see this actually a lot in my practice, where I'll identify someone as being anxious and they'll explain, of course I'm anxious. Look, there's COVID, there's Donald Trump, there are wildfires, there's police brutality and racism in our country. And while all these things are true for everybody I see in my practice, meaning they all can be affected and are all exposed to these problems, the amount of attention that people who are anxious spend thinking about them is disproportionate. And that's largely a matter of how much television they watch, how much media they're exposed to. Environmental factors are another contributing factor to anxiety. This includes substance use, it includes childhood trauma and adverse events. So that's a general picture of why people become anxious. What exactly results from being anxious that can explain why it shortens lifespan? When we are anxious for a short term, it's good. We are primed, we're activated. It's our fight or flight sympathetic nervous system response. It results in elevated cortisol and adrenaline. It's what primes us to fight or flight. Our visual acuity, our cognitive function, our muscles are all primed for fight or flight. That is great if we have to run from a lion or beat up a bear. But in the long term, when stress is chronic and anxiety is persistent, it causes health problems. Cortisol is one of the two main hormones, the other one being epinephrine, that are released during the fight or flight response. And cortisol is persistently elevated in people with chronic anxiety. What this can do that harms us is increase blood pressure. Increased blood pressure leads to higher risk of heart disease and stroke. Decreased serotonin. So anxiety can cause elevated cortisol, and elevated cortisol can in turn diminish mood in a vicious cycle where cortisol is released because we're anxious, and cortisol results in mood symptoms like depression, which can then reinforce the anxiety and elevate the cortisol still further. Elevated cortisol leads to compromise of the immune system, so we're more prone to infection. This can explain why in college, during exam periods, students are more likely to visit the health center with colds. Increased blood sugar. Cortisol constantly present elevates blood sugar. Elevated blood sugar leads to diabetes, insulin resistance, and obesity. We can see now the common contributing factors to anxiety and the main response to anxiety that affects the body and overall health, which is the fight or flight stress response. Turned on acutely, great; chronically, it can be a real health problem.